Welcome to the Birth Lounge Podcast, an empowering space for expecting and new parents to hear candid conversations with experts, support your mental health, and learn the tips and tricks that thousands of parents have used to craft their ideal birth. We will answer all of your questions, the scary ones and the weird ones, to help calm your fears and feel confident going into your birth. I'm going to help you redefine what birth and motherhood looks like and how to embrace your journey. I've intentionally crafted a list of experts to help you navigate pregnancy, explore your birth options, and plan for postpartum so that it can be a time of soaking in your tiny human. We're going to go there on all the hard topics so that you can dive deep into finding your confidence and freeing yourself from fears around birth. With over 10 years of experience in family education and a master's degree in human development and family studies, I created this podcast as a way to share the resources parents need to make educated and informed decisions about their care in pregnancy and childbirth. This is a birth community driven by evidence-based information and research in hopes to help you explore your options, understand your rights, and know what choices you have along the way when it comes to birth and beyond. I'm your host, HeHe. Now let's get to the good stuff. Ellese, welcome to the show.
Hey, HeHe, I'm excited to be here.
I'm excited to have you. When our team, so we often get hired by medical professionals, and I, over the years, have become comfortable asking them why. And almost always, 9 times out of 10, it is because they know about being in healthcare and how the healthcare system works and about the potential manipulation that they're going to face. And they want a team of people behind them and beside them to help guide them through those decisions. So I'm very excited to have you here today to talk about not only your birth stories, but how it impacted you as a pregnant mom and someone who's about to have a baby, but also as a professional in this birth space because you had knowledge about the healthcare system. You went in and I know you discovered things that you were like, oh my gosh, this just cannot be true. This cannot be the type of care that we're giving everybody. And before we dive into that piece, I think it would be a really great place to start of hearing your birth stories. I'd love to hear your first birth story, which was kind of dreamy and good. And it was like, it was what you wanted, as much as birth can be with all the unpredictability. But then you went on to have a second birth and it wasn't so great. The prenatal care was a little bit different than what you had expected. Your pregnancy was a little bit different than what you had experienced in the first time. So before we get to your second one, break down what your first birth looked like. Who was giving you your care? How were your prenatal appointments? How did that birth go? How are you feeling throughout that birth? All right, I'm going to let you start there.
Yeah, I'm excited. I think it's very interesting because my two births were really different. So I wanted to share some of my insights and personal experience in a large healthcare system, both as a birthing person, like you said, and as a clinician. And I am a pelvic floor physical therapist. I work primarily with pregnant and postpartum women. And I have a lot of experience, not just with my patients, but also this interdisciplinary team of the medical team, the OBs, the labor and delivery nurses, the midwifery team, neonatal pediatrics, right? So I have a lot of connection in that system. And personally, I have two sons, right? So I have a 3-year-old and an 8-month-old. And those two different birth experiences, I just want to preface our conversation, have really changed how I personally view like maternal healthcare in the US and how things typically unfold. And it's also really shifted how I work with patients and professionally how I advocate for my patients and how I think education is really important. So with my first birth, I chose to deliver in a local birth center. So my delivery was in February of 2021. So this was big time pandemic. And some of my decision to birth outside of the hospital system was just, I wanted to have my partner and my mother there, right? Because at that time you couldn't have more than one person. And so I was looking for options that I felt comfortable with. I really am comfortable in the hospital setting. and it doesn't, the whole medical environment doesn't throw me off the way that it does for a lot of people. So that wasn't so much a factor. But I have done enough research and I know that choosing your birth provider and your birth location are important. As right, we've read all of the stats on rising C-section rates early, all the research on how birth positions can change your outcomes. And it's important not just for your own personal satisfaction and experience, but also the very real ways that it impacts your physical recovery. So as a pelvic floor PT, I was all about that. And I have also seen, unfortunately, a lot of patients who had post-birth complications that, in my opinion, could have clearly been prevented or at least reduced in severity. And that's heartbreaking to see when you're like, oh, if this just hadn't been done that way. Yeah. So anyways, in my first birth, I chose to deliver at the birth center. It was a standalone birth center, but really unique in the way that the midwives who were employed there also had hospital privileges, right? So this is really important to me, was that if I needed to transfer to the hospital, there was a plan in place, really well ironed out, that the midwife who I knew and trusted and had worked with would come and be in charge of my care.
Nice.
That's not super common, but was really cool. And so for me, that was really important. Again, coming from somebody who at this time really was entrenched in the medical world and really did and still do value modern medicine and the availability of interventions if things go wrong and having access to that. I still had in my mind this idea, though, that birth was a medical event and I needed medical support and I wanted access to that, but I also wanted a low intervention birth. And so the birth center really felt like the perfect, like, best of both worlds for that. I felt really lucky to have access to that particular location. My prenatal care, labor and delivery were exceptional. And I attribute this to the fact that the providers in the institution, the facility, were completely aligned with what my birth goals were. So I was never having really to push up against anything. Everything felt in alignment in terms of the way that they respected physiological birth and handled prenatal testing and discussed due dates, right? Like, all of the visits felt very collaborative, and they even required all of the patients to take a birth course that they provided. Again, even in my field with my expertise, I did it with my husband, and we both learned things. And I think it's a huge key piece of birth, is going through that process of sitting down and thinking about and looking at birth. And I tell a lot of clients now to check out the Birth Lounge because I think that it's awesome resources. And I think, as you say, like, you need more robust information that provides options and data and really no agenda. So anyways, I'm detouring, but yeah, I had a great prenatal experience. The delivery. So here's something interesting. My delivery was somewhat miserable. It was 36 hours and 4 hours of pushing. And I threw up through pretty much all of it. Like, with every contraction, it was tough. And ultimately, my baby was born with face presentation. So his positioning just was making it really hard for him to get out. And so I think it's important kind of to recognize this, that even it was pretty tough. And there were definitely like moments when I was like, I don't know if I can do this, like asking for medication. They were like, we don't have that available. But what I'll say is, even like immediately after, when I was, oh my gosh, and exhausted, I felt so held and supported by that space and my birth team. And what resulted was that even though it was a pretty rough labor, and I ended up with some pelvic floor complications that I had to work through and resolve, I genuinely felt empowered. And I think that's the key piece, right? Like, nobody can make your birth like sitting on a cloud, and it's not going to necessarily feel like a picnic in a meadow. But when you leave that feeling empowered and just in awe of your body and what it's capable of, I think that's a really magical experience and something of value. And I got to have that.
That's amazing. That goes to show that the way you're treated in labor is more important than actually what happens in your labor. If you are treated with respect and compassion and consent and respect for your autonomy, things can go off course because they often do in birth, that things very rarely go
Right.
as planned, quote unquote, or as we'd hope. Not to say they're all bad. It's just most births have these pivots where we're like, all right, didn't see that one coming. And if you are treated well in those moments, it makes it so much easier for you to cope with that change, that
Yeah.
pivot, that unexpectedness.
And I think that's the difference between feeling like your experience was traumatic versus not. I
Totally.
think it has
Same.
everything to do with how you were treated and cared
Yeah.
for. And this is a side note, but I think it was an unexpected outcome for me that
Mm,
this experience of feeling like that supported really shifted my relationship to my body too.
wow.
So I am an ex-dancer and I have dealt with in my life eating disorder history and really being hyper fixated on exercise and my body's appearance. And I would say that giving birth in that experience and become a mother really shifted my perspective to recognizing how incredible our bodies are and what they're able to create and birth a tiny human. It's just so freaking cool. And I think an important piece of that was like having a birth experience that really supported,
Mm,
like you said, my own autonomy in childbirth, my own strength, and providers that had trusted in my ability to get the baby out, right? Like they weren't like, oh, this is difficult. We're going to have an episiotomy or do some crazy intervention, right? They trusted that. And having had that experience was really profound in creating a new relationship for me with my body and allowing that to bloom. And I feel like I will be forever grateful for that. I don't know that motherhood does that for everyone, but for me, it's been really special and meaningful.
so I think it could be like that for everybody if they were given the space to really experience that type of birth. It could be this healing event where it heals past wounds and traumas because you literally are a changed person, right? The person you go into birth and the person you come out, they're two different people. You are
Yeah.
in the same body, but not even. Some would argue, no, you're in a different body, even. It's just, it could be a healing experience for everyone. I think that unfortunately, a lot of people are robbed of that experience by the care they're given.
Yeah, there's a difference between feeling like things are done to you and the medical provider is quote unquote delivering your baby, as
Mm,
opposed to feeling like I myself have gone through this process and look at this awesome thing that I've done. And every mother has done something amazing, no matter how you've birthed your baby. But I think it's easier to feel that way when you are able to go through this process. Um,
yeah,
and like you said, be really cared for and supported along the way. So that
yeah.
was a really, like I said, it wasn't the most glamorous or beautiful birth, but it was really profound and life changing. And I'm so grateful for it.
In a positive way, even though you had 30 plus hours of labor, even though you were like, I don't know if I could do this without medicine. And they said, that is not a choice here, friend. Even though you had that face presentation, you still came out with a positive outcome
Yeah,
slash experience slash feeling around your birth. And I think that in itself is profound. Talk to us
everything.
a little bit about that face presentation. They're super rare. I just had my first one. I've been a doula since 2016 and I just saw my first one. Wild,
Yeah.
wild experience to see a baby looking back at you like that.
I didn't see him and I'm glad because that
Yeah.
would have freaked me out. I didn't have the mirror. I wasn't using a mirror. I felt very aware of what was going on physically.
Did you
But
know that he was in a funky position?
we just knew that we were having trouble getting him out. So he was in the birth
Totally.
canal for quite some time. Like it
Yeah.
wasn't like he was high up. Even if I had been in the hospital, there wouldn't have been, I don't think C-section would have been an option because he was so low. But at first it was that I didn't feel the urge to, I wasn't feeling the right urges. And they thought that was funky and they were not really sure what was going on. And my water never broke. They actually ended up breaking my water, thinking that was going to help the sensation and feeling feeling him in the right spots and feeling the urge to push. And I actually don't think that was as much to do with it. I think in hindsight, it had to do more with his positioning. And yeah, he was just stuck. And we just tried a million different positions until finally it clicked. And I was in quadruped and using the birth ball. And it was just like, okay, this is how he's going to come out. And everything was fine. Everything was safe. They were monitoring with the Doppler. It wasn't continuous monitoring, of course, but they were just monitoring with the Doppler, making sure that he was fine, even though it was taking a long time, and that baby was safe and not stressed. But when he came out, he was so bruised up, so bruised up. He looked like an alien. His head was crazy shaped. His face was like purple, like he looked like he had been in a fight. And this, he is like the sweetest thing. My husband saw him and just started weeping and was like, he is perfect. He's so beautiful. And I'm looking at him and I'm like, what? Like, what? Oh my gosh, something has to be wrong because he is so bruised up. And it wasn't until months later when we were like looking back at pictures that my husband even recognized that he was bruised. He was like love blinders on. And I just think that's so sweet. But yeah, he was pretty bruised and we had to go for jaundice checks because of
Mm,
that
yeah.
for like the first week, but he was fine. He just
Yeah.
looked like he'd gotten in a rumble.
Yeah, so I think that's what surprised me the most was how beat up these babies look. You nailed it. Like they do look like they have been in a fight. They are so swollen. I've never ever seen a baby that swollen before. I too was worried, and the hospital staff kept reassuring me that I was normal, everything would go down. It was not until I saw pictures of that baby looking normal that I actually believed them. And I don't know if that's terrible to say. I just, for
No,
some reason, I didn't think that they would tell us the truth if it wasn't going to go
yeah.
down.
Yeah, they were like, all the swelling is superficial. It's
Yeah.
not under the skull, but it was scary looking. And
Yeah.
I, for a point in my career, I worked as an early intervention physical therapist. And so I've worked with a lot of kids with like developmental delays. And, of course, like all of those scenarios
Hmm.
were going through my mind when that was happening. And for me, you're going to laugh at this, but I was doing standardized testing on my son for probably the first 4 months just to make sure he was okay.
I
I'd like
laugh
have,
because that would also be me. I don't know if I've ever told you, but I have a background in early intervention as well. I was
oh, yeah.
a developmental specialist. And so I'm like, oh, I'm the same way, at least. I would be like, is he looking the right way? Can we-
Yeah. Totally. Like
Are the legs working? Yeah.
my mother-in-law would be babysitting. I'd be like, did he reach with both hands? Does he just use his right hand? Like totally off the charts. But that's just my personality in general is to be like really hyper vigilant. He's, like I said, he's a 3-year-old. He is super physical, amazing, smart. Nothing's wrong, but that face presentation just bruised him up and made him
Yeah.
look really a little bit scary when he was born. And then we did do some body work for him. I think prior to this, if somebody had talked to me about body work for babies, I probably would have like internally rolled my eyes and been like, baby doesn't need that. But he was so fussy and colicky that I was like, I'll try anything. No harm. And
Yeah.
we did.
Yeah.
I don't know how much it helped, but I was just like, if my body feels beat up after that birth, his probably does too.
Totally. Totally. Okay. We could stay on this topic for ages, but I do want to hear your second birth story. I want to hear how it was different because the pregnancy was different and that kind of catapulted you out of your birth center setting into a hospital setting, which obviously super different, totally different providers, not in just like who the human is, but their training, their perspective that they approach things with, all of it just super different. So, step us through why you were at the hospital system, why you needed to be seen by a physician rather than a midwife, and what that care looked like.
Yes. Interestingly, I actually started out my second pregnancy deciding to work with a home birth midwife.
Oh,
So I think I felt so confident after my first delivery, I was like, this seems like a good option. The birth center had unfortunately closed. And this is something that's happening all across the country, that
Mm-hmm.
even though we have research showing like lower preterm delivery rates, higher birth rates, better breastfeeding outcomes, lower C-section rates, like all of these great outcomes, excellent outcomes from birth centers, and cost effectiveness. I think there's data that shows like similar births are about $2,000 less at a birth center compared with traditional hospital care. But yeah, we're seeing closures all over the country, and I don't know all the details about the finances, but I think a lot of it has to do with how restricted midwifery care is, and then also just really poor insurance reimbursement rates. So I was really bummed that the birth center was closed and I couldn't just hit repeat and do the same thing again.
Mm.
So I chose to go the route of a home birth. And I got lined up with this woman who has tons of experience and is like a living legend in the field in my area. And she's done a lot of midwifery advocacy and home birth advocacy. And I was just super stoked to be able to like get on her caseload. And everything was going really well. I loved my visits with her. And then everything pivoted when I went in for my anatomy scan at 22 weeks. So I remember being there. It was like taking a long time. Like it was just taking forever. And I was like, why is this taking forever? And I was starting to get nervous. And then after the scan, instead of just like the doctor poking his head in and being like, I went and they took me to a little private room and sat me down, and I waited. It felt like eternity. It was probably like 30 minutes, but it felt like eternity. And I was just sitting there and I was like, I know something is wrong. And then the maternal fetal medicine doctor comes in and she goes, I hate to have to tell you this. And she proceeded to explain that the anatomic ultrasound showed an aberrant right subclavian artery. And I want to interject. I think this was like the first experience where I was like in hindsight, I look back and I'm like, that was really poor communication, because you never want to start a conversation with, I hate to have to tell you this, right? That puts somebody into fight or flight. And everything that you say after that, it's going to be hard for them to process. So I
Totally.
actually went back in preparation to talk to you. I went back and I looked at some of the documentation, and it says that she discussed with me that this was actually considered a normal anatomic variant in a lot of cases, and that in isolation, when nothing else is wrong, it's benign, asymptomatic, wouldn't change the heart's function. It's just like a little bit different placement of that artery, and that the heart was functioning well, but that they wanted to do an echocardiogram just to make sure nothing else was missed, right? That they didn't miss something else in the heart. And but again, in that conversation, I heard none of the positives, right? Like I heard none of the things saying this heart is functioning well, baby's okay. All I heard was, unfortunately, I have to tell you this, right?
Mm-hmm.
Um,
So wait, pause right there. What would you have wanted her to say? So pretend I'm you and you're the
yeah,
doctor and you've just come into my room. What would a doctor say?
yeah. So I think saying, especially in this scenario where really at that moment there wasn't much concern, I would have loved for her to have started saying, these are the things that look great in the baby. We looked at his lungs, his brain, his spine, all of his organs. Everything looks great. We do see this little variation in his heart arteries, and it's nothing that necessarily is going to impact his function. Everything seems to be functioning well, right? Like emphasizing, and not to be like brushing things under the rug or like deceptive,
Or
but
dismissive?
not to be dismissive. But in this case, I think, like I said, when you have conversations with people, it's very hard to hear things after you hear something scary.
Hmm.
So I think presenting first the positives and then talking about what is atypical in the finding, and then going into what are next steps, instead of starting with something's wrong.
Yeah. Hmm.
One of the things, so in terms of that heart variation, like I said, there's very little, very low risk of anything, any complication It just looks a little bit different, right? But one of the main concerns was that that variant could be linked to a cluster of genetic syndromes. So this was the really scary part. And so that provider did set me up to talk with a genetic counselor, and we discussed some of the possible diagnoses that could be linked with that heart variant. They explained to me that if that heart variant is in isolation, it's very low risk, but if it comes with other ones, it's higher risk. But the biggest thing was that it could potentially be linked with really a couple of diagnoses, one in particular that was really medically complex and potentially a fatal outcome for a baby. So this is what put me into the maternal fetal medicine world from a home birth and really got me shifting the trajectory of where we were headed. And it was a roller coaster. I think in the next 2 months, I had 16 appointments with specialists. And one of the things was we were weighing the pros and cons, and we elected, my husband and I, to proceed with an amniocentesis. So we wanted to be prepared if potentially there was something that was, we were going to have a very medically complex child, really tragic outcome. We wanted to be able to wrap our heads around that. And amniocentesis is not without risk. I think it's like 1 in 900 risk of miscarriage. So it was a big decision, but ultimately we were just like, we need to know and have more definitive answers. So we did that. And then it takes, I can't remember how long, you might know, but I want to say it took 2 weeks to get the results back. And the results came back negative for the things that we looked for. Like we were really, felt like we dodged a really scary bullet. And we're like, at this point, okay, now we just need to know what's going on with this heart anomaly. It seems like home birth is still an option. I just really wanted to get the cardiologist to give me a clear green light, right? To say this baby is fine, proceed with, do what you want. And so I actually, the cardiologist that I was scheduled to see is an expert in pediatric fetal echocardiography. And like I live in this area that is a mecca, a medical mecca, like Duke, University of North Carolina, like these hospitals have all the specialists. So for better or worse. And so you're laughing. This guy was not available until the end of my pregnancy. And I was like, I need to figure out where I'm giving birth. So I actually made an appointment. He worked like 2 days a week at a different site in a different city. And so I like made a sooner appointment. I drove an hour or so to go see him, which is not that much for lots of people who live in areas that don't have access to care. But for me, that felt like a lot because like I said, I'm used to being able to see anybody I want in 10 minutes. But yeah, I had the appointment. I went, they took 72 pictures of his heart, just this little baby heart. And then I was having the conversation with this pediatric cardiologist. He sat down, he talked to me about what exactly this heart anomaly was. And then he goes, but your baby doesn't have it. So it was a false positive. So there was no heart defect in the first place. And I just remember like sitting there, I was like shaky. I felt like I was going to throw up. Of course, you're relieved, but you're like, oh my gosh, all these mental gymnastics that I've just been through, the like premature grieving and heartache. And it was just wild. I went and I sat in my car because I was like, I need to sit before I drive for a while because I was just so, what in the world? And it took a while really to shake that because I was like convinced that there was something terribly wrong. But on the way out, I did ask him, I was like, we were planning a home birth. What do you think? And he was like, have the baby where you want to. Like, it's totally fine. And so it seemed like we were in the clear. And then a week later, we got more amniocentesis results back. And we were like, what? Because we thought we got all of them.
Can I pause you here? I have a quick
Yes.
question about finding out that it was a false positive. Was there
Yes.
any piece of you that was angry? Because
Totally.
I would be just furious at the anxiety
I,
that I had but didn't need.
yes. So I was very angry. I was pissed. And
Mm,
that's a hard thing to explain to people because anybody that you
totally.
talk to is like, oh my gosh, it's so wonderful that nothing's wrong. Of course, it's wonderful. Of course, you're relieved and happy, but you're also like, what the fuck? Like,
Totally.
excuse my
Like, why
language.
did I have to go through all of this?
Yeah.
That is
I mean,
crazy.
and also like like I said, taking on the risk of the amniocentesis. And I was,
Totally.
I was just pretty devastated for
Mm.
those 2 months, just really feeling like our lives were going to totally change and we were potentially going to have a baby with a terminal illness. This was really heavy stuff. And it's hard being pregnant with that in your mind too, because everyone's, oh my gosh, how's your pregnancy going? And you're visibly pregnant. People can see and they're talking to you about it, and you don't want to talk about it because you're like,
I'm
you're trying,
stressed. I
yeah,
am
trying to process,
stressed out. It's not well. We
stressed
are
and
not well
scared.
here.
Yeah.
Yeah.
Yeah. And especially in my world working with pregnant and postpartum women, it was like, that was tough. That was a tough time. So I was definitely angry. And it's easier to say now because I'm a little bit removed from it, but I'm not angry at the false positive. I'm angry a little bit still, and my husband's over it. I've put that behind me, but I still feel resentful a little bit that it was not presented as, it appears that the baby maybe has this, or it was not presented with any sense of uncertainty. It was presented like, this is absolutely what the baby has
Hmm.
going on. And when I looked back at the documentation, it did say those things of the appearance of possible ARSA, which is the variant. The providers know that ultrasound does have the possibility of false positives, and
So
they
see,
know.
sorry to cut you off. For me,
No,
it's this type of shit that makes me think it's intentional. You documented one thing, and the way you presented it to a patient, totally different. There's no piece of me that you will ever be able to convince that somewhere between documenting it and talking to your patient, you didn't think, these two things aren't the same, but I'm still going to go for it. I'm still going to treat these two things differently.
I think it has to do with becoming so jaded that you don't feel like you're talking about things that are a big deal.
Oh my
So
gosh.
I know maternal fetal medicine docs, their role is working with high risk pregnancies and things that are going wrong. So their lens is viewing everything in that light, and it becomes normal. And they might have training to have some bedside manner, but they just lose it. This is my opinion, right? They are brilliant and they know, so much, and they know how
For
to care
sure.
for people who have things that
Very
are going
complex
very
situations.
complex things.
For sure.
But again, that has become so normal to them that they're not sensitive to your experience and how you're interpreting things. Just when that woman came in and was like, I hate to have to tell you this, that's not how you want to talk to a pregnant woman.
Yeah.
And
How do
so
we
I
fix
don't
that?
think it's intentional, but I think it's problematic.
Yeah. I don't know. It feels a little intentional to me. When you're documenting things like possible this, why wouldn't you also say that to
Yeah.
a patient? It just feels like you intentionally left it out. I don't know. I don't
It's,
know. I
I
don't
mean,
know if I could ever be convinced otherwise.
I
I That's
think,
crazy.
yeah, and I think there's like this almost like perception that like what we're talking about is so complex, so I need to simplify it for the patient.
Hmm.
But that's not the way to go about it. Like, it's your job. And this is again how I feel like I've changed and like really trying to make sure I do this with my patients and clients. It's your job as a provider to figure out how to explain complicated things in a way that patient understands, whether that person has a PhD in genetics or that person didn't graduate high school and
Yep.
doesn't speak English, right? But the onus is on the provider. And it's just lazy to not do that.
Yep. Oh my God. I could just like standing ovation here. That is so
Well, just
frustrating
wait
to
for the rest
me.
of the story.
I'm
Just
like a little
wait.
scared, actually. I'm like a little nervous to hear how it can get worse. Okay, my question is, how do you think we fix that? And then we'll pivot to you got additional amniocentesis results.
Yeah, I don't know how to fix it.
It's
I
tough. Oh,
I think so. This is where I think a lot of it is, it can't be taught. I remember in one of my clinical rotations in physical therapy school, I got feedback on one of my evaluations that was like talking about all of these soft skills, right? Like empathy and like how I communicate with patients. And I remember being like bummed, like almost, okay, you're telling me I'm good at being nice. Does that mean I'm like not smart or something? In my mind, I was,
Can I be both? Am I allowed?
well, it was more of you're emphasizing these things that I thought were like
Positive qualities.
just obvious and just common sense and just how you talk to people. And it wasn't until I was a clinician taking on students that I realized the challenge that some people have in doing that. I would have really smart students from top PT schools come in and they knew all the right stuff, but their ability to talk to and measure and mirror how a patient was garbage, just like terrible at it. And that's a really hard thing to teach.
Hmm. Yeah, it's like their social
Um,
skills are missing, or I guess communication skills are missing, or just like interpersonal relationship skills are missing. Maybe
yeah,
all of them? Question
like
mark.
the ability to read the room just wasn't there for, I had a couple of students like that, and
Painful.
it was challenging, and
Yeah.
they found their way and they found their way into a specialty working with specific populations that was probably okay for, which is great. But yeah, you're as a pregnant person, you are, and I would say postpartum too, that's one of the most vulnerable times in your
Yeah.
life. And you need those providers, especially the ones working with high risk pregnancies, to do better. They just need to do better.
Yeah. Yeah. I always hear, yeah, we know better. We know this. We know that. Okay, then do it. I just get so frustrated when they're like, yeah, we know this. Then what the fuck? Why aren't we doing
Yeah.
it? Why is the data so far behind getting into the hospitals? The data's here. Why can't we implement it? Can't,
Yeah,
won't, question
I
mark?
think it's this is where like the way that medical school, and I could go on and on about this, but the way that like medical school operates is there's just this like very odd like hierarchical setup, and you go through this and you feel I've been through this, and so this affords me to be an expert, and being an expert means that I don't know, it's almost like you feel like you're holier than thou, right? That you're a god, and you're not. You're human, and humans make mistakes, and humans can also continue learning. So I think a lot of times it's practice pattern. Like you start doing something when you graduate, and good doctors continue to revise and evolve, and not so good doctors just continue to do what they learned in med school 20 years ago.
Dang, that is a really tough pill to swallow. Okay, I don't want to dive into that anymore. So let's shift and talk about your amniocentesis. So we got additional results. What did these yield?
Yeah, so backing up, when you get an amniocentesis, you decide what you want them to look for, right? Because they can tell you everything. And so you decide, I want you to only tell me X, Y, and Z,
Hmm.
only look for these things.
Hmm.
So we wanted to look for the genetic markers that were potentially linked to the heart variant that our baby ended up not having. But we also wanted them to look for long QT syndrome. So my husband has a specific variant of long QT, and this is an electrophysiological problem with the heart. So it's not structural. You can't see it on an ultrasound. And it results essentially in a elongated QT interval of the heartbeat. And it typically shows up in adolescence, where kids will have arrhythmias or syncope, they'll faint, and in some cases, they'll have cardiac arrests if not treated. So it can be very serious if it's not treated, but it's very low risk if it's managed with beta blockers. So my husband was tested as a child because his brother started fainting. They figured it out about his brother, and then it's genetic, so they tested him. And with my first baby, we just had to do a genetic test and an EKG when he was about 6 months old. And that was our plan for this baby as well. But since we were doing an amniocentesis, we were like, let's just go ahead and test him so that we have one less thing to do later. It was really more of a decision about convenience, right? When we have a 6 month old, we won't have to go to that appointment. That sounds good. Let's do it. And the results came back that the baby had the gene, the same gene as my husband for long QT. And at first, when they called me to tell me this, I honestly wasn't super worried because my husband has a lower risk genetic variant for long QT. There's lots of different genes that can contribute to it, but his is very low risk. And he knows a lot about his condition. He has also been very lucky in terms of medical care he's received, and has worked with, for a long time now, a specialist who, like, that's his bread and butter. He sees long QT and that's his thing. Again, we're lucky to have that available to us. and has been essentially told like you have zero risk as long, you can't ever say zero risk, but you have very low risk as long as you take your medication, like no concern for change of life expectancy or real concerns. You can do all of the physical activity you want. Everything's fine as long as you take your beta blockers. But then the conversations with maternal fetal medicine were not lining up with that perception for me of this is manageable. They were really throwing at me all of these changes to the prenatal plan and recommendations that didn't make sense to me. They were saying things like we would want to do weekly NSTs starting at 32 weeks, weekly biophysical profile testing, weekly ultrasounds, and an induction at 38 weeks. And on top of that, they were talking about things like a risk of stillbirth and SIDS and recommending all of this more testing. And like I said, none of it really made sense to me. Again, like this is an electrophysiological issue. How are we going to see that on an ultrasound? It's not a structural abnormality. And again, as far as I knew, this shows up more in adolescence. So why are they recommending an induction and all these things? And I didn't understand how the test would be helpful. And when I brought that up and was like questioning it, again, my background, I've always appreciated medical professionals. I've been in this world. I very much fully expected them to meet my questions with answers. And instead, I was met with kind of like almost shaming and like dismissive and even language. Like I never thought I would hear this of if you want your baby to live. And that blew my mind. And at least I knew it was a red flag, right? Like at least I knew, hold up, don't, like that's not what you say to somebody if you care about them and you're trying to have a constructive conversation and discussion.
Totally. Don't
Um,
threaten someone's baby's safety
no,
to
and
try
act
and
like
get
they
what you want.
no, and act like they don't care about their baby if they're just asking
Oh,
questions.
yeah. If the parent acting as if that parent is negligent for
Yeah.
wanting to have a discussion about this. Did that in any way erode some of your trust with your healthcare providers?
Yes. So like I said, that was the
Totally.
red flag that I was like, what? That's
Wait a
not how you
second.
talk to somebody.
Yeah.
Um, and
It's the same high risk team that had delivered the information about
yeah,
the heart variation. It
yes,
is. This is your second time having a poor interaction where you're just like, guys, come
this is,
on.
yeah. Yeah, I don't know if it gets worse, but it's still bad. So
Oh my
when I
God.
asked for when I asked for, can you explain to me these recommendations? I was not sent a message explaining it. I was sent a PDF of a research article. Now this really fucking pisses me off because I'm sorry, I keep swearing.
No, I love it.
Because because as a provider, again, I am not talking to people. It's again, it's my job to explain things as a provider.
Sure.
And it is so effing lazy to send this research article and probably also I feel like a little bit bullying because it's here you go if you want this.
If you can read this, if you know how to
Yeah.
read research, then here it is. Yeah,
Yeah.
no, that's
Passive aggressive, right?
totally. And very, there's some sort of privilege in there. That is an abuse. That's an abuse of power. Saying, I can read research. So if you can read this, here's the resource for you. Here you go. That's
Yes.
horrible.
My husband is well educated and he wouldn't know what to make of these things because he doesn't know the medical jargon.
Sure.
Fortunately, again, all of this is I'm recognizing I can handle this, but how can 99.9% of people handle this, right?
Totally.
So I read through this article. I can read and analyze literature and look at what the data says. And first of all, the research article was not about long QT syndrome. It was about other heart arrhythmias in babies. And it was, so that was like also like it's not specific. There's reason for that, right? This is very rare. But even with that, it was something like the risk of stillbirth was still 38 in 10,000, something around that. And to me, how much better would I have felt going home if somebody had said the risk increases, it's still very low, 38 in 10,000, as opposed to your baby is at high risk for being stillbirth and you should do all of these things, right? Like I went home obsessively counting kicks, crying all night, like just devastated. And then I get this information. I'm like, wait, that's really low risk. So that was where I really feel like I lost trust. And
Totally.
it doesn't feel good to feel like I don't have trust in the people who are taking care of me.
Exactly. Think about how all that cortisol impacts that baby, right? And there are thousands and thousands of women being treated like this in the US healthcare system when they're pregnant. Just
And
unnecessary testing, unnecessary conversations that could have been done so
different.
much better.
Yeah. And people without the privilege and connections that I had. So, like, the next thing that I
Totally.
did was I made an appointment with my husband's cardiologist to talk about the baby. Like, most people don't have access to a long QT specialist, right? Like, that they have connection to. But I was just like, these things aren't matching. I don't like how they're talking to me. I want to talk to an expert who really knows this particular abnormality
Totally.
syndrome. So I have a conversation with him, and it was just like, again, it was like, what, why are they doing this? And I felt very upset almost to hear these things. Like, why have I been put through this? He was saying that the ultrasound and the NSTs really would have no correlation with long QT syndrome. So like we were saying, like, doesn't really tell us anything. And he alluded to, without wanting to step on toes, because he's in this field, that they're probably just throwing that out there because they weren't sure what to do. And he said they're recommending to induce early because I have this from the documentation. Again, I reviewed it last night, in quotes. They do to most everyone to avoid anything, induce early. He
Wow.
said
We
not
don't know what to
necessary.
do, so let's take away someone's autonomy. We're not
So let's
sure
do
what the
something
answer
that
is.
could lead to more complications. Yeah. And he said not necessary for long QT. In his view, again, from the documentation, pregnancy and labor in the context of these findings is still really low risk. And he assured us that it would be exceedingly unlikely for anything abnormal to happen,
Hmm.
risk similar to that if he did not have the diagnosis. So his primary recommendation was that he said things could be arranged with a home birth, they could be arranged with a hospital birth, but neonatal care would be a little different. So regardless of what an EKG showed, they would start him on beta blockers because the risk of beta blockers is so low, and the risk of not treating could be bad, right? And I'm on board with that. I was like, okay, totally makes sense. Beta blockers in infants can cause hypoglycemia, so he would need to be monitored after that. And so we ended up deciding to switch at this point to the hospital birth because the logistics of having a home birth and then being admitted to the hospital for monitoring while he was
Hmm.
on beta blockers just didn't seem feasible. But he had a very candid conversation with us about this, and I appreciated it, but it also probably made me a little bit afraid for good reason. He said that they would be itching to intervene
Hmm.
because they don't know what to do. He said likely if there's anything wrong in monitoring, they would want to do a C-section. And he said it would be very possible that they would sweep the baby away when he was born, but he was very clear that the baby did not need to go to the NICU and it was not his recommendation. So he was amazing. He wrote this plan up as the expert for me to deliver to my providers, and really like concrete recommendations from a true expert. Again, most people won't have that, but I was able to go back to maternal fetal medicine and say, hey, this is what is recommended, and this is what I want. At my next maternal fetal medicine appointment, because I was still trying to navigate, how do I now at this point switch my care to the hospital instead of my home birth midwife, who was still in charge of my care, technically. And I started the conversation. I'm not a confrontational person, but I started it pretty confrontationally, just saying, I feel like there has been gatekeeping of information. I feel like you've not been transparent about where recommendations are coming from and like how much like things were unclear. And I really didn't appreciate the coercive language. And
Good for you.
I was really upset. I wanted to
Yeah.
discuss things openly and have somebody talk to me about which tests and interventions were truly necessary and which were just being thrown out as a what's the harm? Because the harm
Nice.
is potential false positive and
Yep.
stress and anxiety, right? And I don't know if I just got a better provider or if having that at the get-go made things better, but that conversation went very differently.
Hmm.
Um, and she was very open with me, saying that the recommendations were being extrapolated from really limited data. A fetal diagnosis of long QT is so rare that they just have no guidelines. And
Hmm.
so they were pulling from other arrhythmias. Mind you, my baby has no sign of arrhythmia, and we've had 16 appointments with specialists analyzing that he's fine, but he does have this gene. So she was super on board with everything, and again was open, saying there was no clear indication for induction of labor. And I found these in her documentation too. So why were they recommending it, right?
Hmm.
Cesarean should be delivered, or cesarean delivery should be reserved for standard obstetric care. So just like with any other baby, and the baby would not need to go to the NICU as long as everything went as expected. But again, since the baby was going to need EKG and that monitoring, we were going to switch to hospital care. And from there, I said goodbye to maternal fetal medicine. It was like, once we got that squared away, I ended up working with the midwives within the hospital. So I will say the midwifery team in the hospitals trained very differently than
Mm.
midwives outside. They train with the OBs, and it's a
Yep.
very different philosophy and way of caring for people. But it was fine,
Hmm.
right? Like it was, I didn't feel pressured. I felt like they were very reassuring. I felt like they were respectful of me. UNC Hospital is ranked very highly, and it's a baby friendly hospital. And this is something that I think is interesting for your listeners is they have all these policies that are meant to promote mother baby bonding, but they're not quite what they seem. I see you nodding. Like,
Because I host another podcast called Unbreaking Birth, and we dove so deeply, literally multi episodes, into this mother baby friendly policy, and it is a scam. It's literally just a title to give a hospital, but the credentials behind it mean nothing. The criteria to meet it is not regulated very well. They're there, but
yeah,
to say that the hospitals that have that title of mother baby friendly doesn't
doesn't mean.
mean very much. That definitely doesn't mean that they actually promote baby mother bonding or breastfeeding.
Yeah. So this was where my doula was really helpful because she's
Mm.
familiar with that hospital. And I'm reading the policies and I'm like, okay, skin to skin, standard of care, delayed cord clamping. This sounds great. Rooming in the hospital, and what other things were in that list. And my doula, again, who's been at births at this hospital, she was the same doula at my first birth. And she was like a guardian angel. So I was super happy to have her on my team. But she was like, yeah, delayed cord clamping says they'll wait a minute. Sometimes they don't.
Mm.
Tell them, so we ended up telling them to wait until the cord stopped pumping. Skin to skin, she was like, oftentimes they'll stimulate your baby and rub them to death and then give them to you in a blanket. And
Mm.
like, we were very clear. I want him actually skin to skin, and I don't want you to mess with him when he's born. Things like that. I think that's where the midwives are a little bit more hands off, but they still operate in as a medical, they still operate like the OBs. So like I arrived at the hospital at 10 o'clock. I had my baby at 10:41. It was very fast. I was very close to having him. And they still came in and they were like, I'm going to do a cervical check, not not asking for consent. They still tried to tell me how to push.
Mm.
And these were all things that I felt capable of handling, but they just weren't exactly what I wanted. I think just with my background, my education, and being prepared, and like all of the work that I had to do to get there, I was able to have a birth that felt good. I wouldn't say great, but felt good.
Yeah.
Um, I still met like all of my primary goals in terms of having no medication and being able to move around and decide how I wanted to have my baby. But yeah, I think it was an interesting experience in terms of looking back. I'm like, how did I have to fight so hard for this and work so hard? So much research and reaching out to other providers and asking for second opinions. And it just felt so almost impossible.
Mm.
And I just don't understand like why that is. I put so much energy into researching, seeking second opinions, clarification, advocating for myself. And it just shouldn't be that way. It
Yeah.
just, at the end of the day, You want your prenatal care to be with somebody who is not going to bully you or shame you and who's willing to work with you on creating a plan that aligns to your values, as well as triaging risks, right? I fully understand that if things are not developing typically, like you want somebody who can have that conversation, but you want them to have a conversation, right?
Mm,
So that you feel informed, not so that they're like imposing fear on you and just telling you these crazy recommendations.
yeah, man, you
So
just
that's
said
my
it all.
story.
Yeah, I was
The
about to
birth,
say, I think that's a great place to wrap up because you just laid it out so beautifully. It's really hard in our country. You can get what you want. You can have a good birth story, but sometimes it really is just a fight, and that's exhausting, and
well,
it's
and I
also
think,
unexpected.
yeah, I think this is where your work is so valuable of telling people not to instill fear or make them feel anti-medical establishment, maybe a little bit. But what you're doing is you're saying you need to be intentional. And if this is an experience that's important, if this type of experience is important to you, then these are the steps that you need to take. Because, like I said, I'm in the system, I have this experience, I have all of these resources and the wherewithal. And a lot of people just don't have that level of privilege. And so I don't want my patients to go into birth feeling like they have to go in with their arms up and like ready to fight, because that's not, like you said, that's not a great feeling. But I think just knowing when to ask for a pause, knowing when to ask for more information and not permitting somebody to shame you out of that or bully you into thinking that's not appropriate. Knowing your rights is important. Knowing how to navigate this system is important. And knowing that it's not always so clear cut, right? Like obstetrics is very poorly researched for good reason. We don't do a lot of research on pregnant women. Nobody wants to take on that risk. So again, that's not out of being evil, but it's just we don't have amazing research on a lot of things. So in my opinion, that means you get to ask lots of questions, right?
Mm-hmm. Yeah.
Right? It's not cut and dry.
Yeah.
So yeah, I think it's really also just changed how I work with my patients, because even people who don't bring this up, I'll just ask them about their plans and what they've done to prepare for some of these hurdles or potential hurdles. And just knowing different options, right? Knowing that you don't have to do everything that is recommended to you, and you don't have to just like blindly follow your care provider.
Mm,
They're not God, they don't know everything, and they do make mistakes. And just in terms of, I don't think I ever would have not believed a patient's experience previously, but I would have thought maybe that was misinterpreted a little bit or
really.
that sort of thing. Whereas now I'm just real quick to be like, yeah,
I
there are a
believe
lot
you.
of shitty ass providers. And there are a lot of great ones, but there are just because of some of the communication mainly that happened to me, I think I have a different appreciation for what patients go through than I did before.
Yeah. Yeah, I've learned a lot over the years being a doula, and I too think I went through a stage. It's ingrained in us to again make excuses for the medical system and some of the treatment that we see. But I've come to learn that we really should believe women, and when we do, the world actually is a better place. Ellese, thank you so much for being here with me today. This has been a wonderful conversation. If someone was interested in connecting with you, learning from you, where can they do that, and what kind of services do you offer?
Yeah, we definitely didn't get into this at all, but I work with women virtually. So I work with pregnant and postpartum moms. My primary passion is supporting women in postpartum recovery, but I think a lot of that goes with prenatal preparation. And again, that's a shift that I've had since this most recent experience. I do 99% of my patient care, my pelvic floor rehab, with people virtually. So we do Zoom calls and programming, and it's awesome. And I really focus a lot on, as you can imagine, I work with like urinary incontinence, prolapse, pain with intercourse, diastasis, core healing, like all of these things that are very common after issues after pregnancy. And the best way to get in touch with me is honestly through Instagram. So I started an Instagram account very reluctantly because I hate social media. But I think it's a great way to disseminate information and again, kind of break down some of that gatekeeping in the medical world. So I do a lot of education on Instagram, but that's just a great place to find me and message me. And yeah, if somebody's interested in virtual work, there's a lot of great, again, I'm evidence-based. There's a lot of great research on virtual pelvic floor PT. I could do a whole podcast on that, but yeah, I think we talked about it earlier, but for any of your listeners, I wanted to extend a special gift because I love you. I totally love HeHe. Yeah, throughout that pregnancy, I listened to your podcast a lot.
Oh, thank
Uh,
you.
it was helpful for me too. But yeah, so anybody that wants to work with me, I'm going to give them, if they sign up for a program, a free month. Just really want to pay it forward and extend some kindness.
Nice. Thank you so much. We'll put a way for you guys to take advantage of that in the show notes. Ellese, I, for one, am very grateful that you started your Instagram account because that's how we met. That's how our paths got connected. Social media is a full-time job. It's a love-hate relationship for me, and I always call TikTok the Wild West of the internet. But
Totally.
I do love it, and I'm glad that you're on there. And thank you so
Me
much
too.
for being here with me today. Listeners, thank you so much as well. I'll see you in the next episode. Be sure to follow Ellese on social media, and you can find me at Tranquility by HeHe or at the.birth.lounge. Until next time, head to your app store and download the Birth Lounge app for evidence-based childbirth education and data-driven postpartum support delivered straight to your phone. Bye.
Bye. Thank you.
Thank you so much for tuning in today. I truly do value this community and I love hanging out with you. You deserve to have a birth that you love with a provider that values your autonomy and respects informed consent. It's an honor to be your go-to gal when it comes to preparing for your baby. If you found today's episode helpful, share it with a friend. Share it with someone who could use evidence-based information to help them have an informed and confident birth. I'd love to hear what you have to say and read your sweet words. By leaving us a review, you are helping other expectant mamas and their families find the podcast so that we can reduce birth trauma and improve maternity care in the U.S. one birth at a time. If you're interested in joining the Birth Lounge, go to thebirthlounge.com. If you want to connect with me on socials, you can find me at Tranquility by HeHe on all platforms. Until next time, stay educated, stay supported, stay confident. Bye.